This is Jerry Hesch. This is our case titled Severe Disc Degeneration at L5-S1 with Probable Pelvic Joint Instability. This is part 4, and this is the fourth video, but it's the third treatment visit. I have a home office. You can see my furniture and you can hear my doggy. And this is the Hesch Institute. We do consultation treatment for complex pain patterns, including sacroiliac joint dysfunction, pubic joint dysfunction, but treat joints throughout the whole body. And we have a clinic very close to Las Vegas, Nevada in Henderson, and we also teach seminars to other hands-on clinicians. So this is a wrap-up visit. Can you just describe what we accomplished today, Deborah?
Well, today we reviewed everything we've gone over the last 2 days. You answered several of my questions. We went over some stuff that I can do at home to help strengthen my body and pelvis, and we also did some upper body work in the neck and shoulder area that helped immensely. How did it feel after you did that and you walked around? I felt like my body was one unit, not two separate units anymore. My body's already, I've always felt like I've had two different bodies. Yeah, so it's pretty amazing. Just those short little things can change all of that.
And how do you feel about you came for pelvic instability. Yeah. How do you feel about that issue and the low back issue?
I feel like I've got a lot more information that I can take back to my PT, but even more than that, that I can control and do a lot of this work at home, which is really important to me. I've been going to physiotherapists and chiropractors for 17 years. I would love to learn, and what I have learned is that I can manage this at home, and I'm confident that I can heal, that I'm already better, so I'll just build on that.
Very good.
Yeah.
And we watched you walk in on day 1 with a cane.
Yes.
Okay.
I feel like that was weeks ago. That's
funny. I know. Yeah. I know. Could you just get up and walk just one more time towards the front door?
I do have one of my supports on. So this is the
okay. Can't see it. It's black.
This is the lumbar support, but I'm wearing it nice and low, as you said. So
instead of wearing the SI belt at the sacroiliac, you're wearing it down at the trocaners.
Yeah.
Good. How's it feel to walk like this?
It feels good. It feels stable. I don't feel like my piriformis is going to go into spasm. And I feel like I have some confidence in my body.
So some time ago, and I don't know when, someone suggested that you needed a sacroiliac fusion on both sides. What month was that? That would have been October. Okay.
Yeah.
Your thoughts about that? Do you feel like you need a sacroiliac joint fusion?
No, I will not be going in that direction at all. Yeah, it was sort of a prolotherapy and or SI fusion, and I think right now I won't be doing either. For sure.
Well, I'm delighted with your progress, and thank you very much for summarizing this. And Brian, anything that you want to add?
The only thing I want to just say is that it was amazing to see how, as you described it, she walked in with a cane. Well, she kind of limped in with a cane, and to see her over the last couple of days be able to move around without it. We even went out for dinner and she didn't use her cane to walk into the restaurant. So it's quite amazing to see how a little bit of knowledge and a little bit of appropriate intervention helps in correcting an issue that's been here for 17 years. And continue to work on correcting it. So it's amazing. We thank you a lot.
Yeah,
absolutely. Yeah, I mean, I'm really pleased with your gains, and it exceeded my own expectations. Yeah. And just to summarize, it appeared that you had some instability at the symphysis pubis joint.
Yes.
In the left sacroiliac joint.
Yeah.
And of course you have the severe disc degeneration at L5-S1. And we worked on all of those structures, worked on integrating all 3 of those, but we also integrated the upper body because you carried a tremendous amount of stress in your shoulders and upper neck and such. So we did 4 things. Yeah. And in response to that, we did I feel like your pelvic joints are more stable now. We found a direction, the transverse plane, in which you lacked motion. And that meant that in the opposite direction of that tested restriction, you had excessive mobility. So by gaining motion in one direction, we actually lessened motion in the opposite.
Right.
Your pelvis, your pubic joint, and your sacroiliac feels more stable in response to that. And of course, you know how to do that same treatment at home.
Yeah, of course. I'll do that every day at home for a period of time.
So
yeah.
Time will tell, but we're off to a good start, and I truly thank you.
Well, thank you, Jerry.